we're going to hit record so that we can get started right on time. And good. So I want everybody to, I'll go back to that first screen here. And see if I can get that back. Thank you very much for joining me today. I'm so glad that you're here. We want to talk about Tai Chi for everyone. I know that the title for this webinar was a little bit different. Was a little bit longer than just Tai Chi for everyone, but here's a picture of my book, Open the Door to Tai Chi, Tai Chi for the Everyday Person. I'm Diane Bailey. I created the Open the Door to Tai Chi system. And one of the reasons that I created the Open the Door to Tai Chi system is that I wanted to bring Tai Chi to everyone. I wanted to bring it out of the shadows. I want the everyday person to be able to enjoy Tai Chi. And unfortunately, the martial arts community has really held it tight. And that's part of my mission, is to open it up. So today, we're going to specifically focus on Tai Chi as an exercise for those with chronic conditions, maybe illnesses, maybe in rehab situations, those that are desiring to be the very best they can be. In other words, the everyday person, right? We're all dealing with something. So we're going to focus on bringing Tai Chi to that everyday person in the context of maybe it's not the fit or the near fit in every situation. So if you've been around me for any length of time, you know this definition that I came up with. Tai Chi is a martial art that utilizes gentle flowing movements to enhance health in the body and the mind. And just real briefly, we're going to talk about Tai Chi, that definition. We're going to look at the benefits. There are numerous benefits of Tai Chi: improving balance and flexibility, reducing falls, reducing anxiety and depression, improving sleep quality, lowering blood pressure, and increasing energy, agility, and overall feelings of well-being. Those benefits have been proven over and over again, and they come from not just doing movements, but they come from understanding the basic principles of Tai Chi. Now, you don't have to understand all of these principles right now. If you haven't done the certification, that's okay. This is something that you do learn in the certification. These basic principles are things like columns, rotation, understanding where your weight is at all times, substantial and insubstantial, moving from the center of your mass, from your dantian, which is 2 inches in from the belly button and 2 inches down, understanding the ball of energy and the circular movements in Tai Chi, being rooted and grounded, being relaxed, and having each of the movements connected to the other. Breathing is very important, and understanding the underlying martial arts applications. So those are, just catalog those things in your head as we go through the webinar today. So the way today is going to work is I have different populations, if you will. We're going to define, maybe it's a chronic condition, maybe it's an illness. We'll have a short definition. Then we're going to go through research, and I'm going to show you that proof of the efficacy of Tai Chi. Fair warning, this webinar is research dense, but stay with me. It's worth it, because in the end, we're going to figure out why Tai Chi is so successful. So what I want you to do right now is I want you to get a piece of paper. I really, truly mean this. Get a piece of paper and something to write with. You'll need that piece of paper. So I'll wait for just a second. Even if you're watching this on the recorded version, later on in the day or later on in the week, I want you to get that piece of paper, have it ready with something to write on. And stick with me to the end of the webinar, because I will be demonstrating some movements that you can use. You can take these to your clients next week. you can use this, these movements to help them with their relaxation, to help them with their exercise, maybe after their exercise. All right, so now you have your piece of paper. What I want you to do down that left side, leaving some space in between each number, is write 1 through 9. Very simple. And then let's get started. So the first group of people that I want to talk about are those with cancer, either maybe dealing with cancer right now or they've survived cancer in the past. Understanding what cancer is, an abnormal growth of cells. It's not just one disease, but a group of diseases. We had a great webinar earlier in the year with Andrea Leonard and the Cancer Exercise Training Institute. If you have not seen that webinar, please go to our YouTube channel. It's Open the Door to Tai Chi. All of our webinars are on that YouTube channel. And you can re-watch the whole thing that Andrea Leonard did for cancer. We're just going to take a brief look at cancer, the studies of how Tai Chi is helpful with cancer right now. So remember I said this is research dense. Stick with me, it's worth it. The potential yield of Tai Chi and cancer survivorship. Regular exercise is associated with reduced risk of developing cancer and of recurrence of cancer with improved survival. A key barrier to physical activity participation is the sensation of debilitating fatigue. But cancer survivors may be more willing to replace sedentary activities with standing or light activities such as Tai Chi. So on your piece of paper, number 1, I want you to write light, gentle exercise, encourages participation. So that's your first on your piece of paper, light, gentle exercise, encouraging participation. Chemo brain is something that affects those that are going through chemotherapy. Tai Chi is understudied but a promising tool to help with survival outcomes, including improved psychosocial health and cognitive function. It may negate the deleterious cognitive side effects of cancer and its treatment. This is part of that because it is movement meditation, perhaps. But this is an interesting study down at the bottom. It said in a study of 23 US women with mild to moderate cognitive impairment, a year or more after chemotherapy. So they're already in a depleted executive functioning state. They were taking 60-minute Tai Chi classes twice a week, and it resulted in improved immediate memory, delayed memory, verbal fluency, attention, and executive function. So on number 2 on your piece of paper, I want you to write improvement in mental functioning and psychosocial health. Don't worry about your spelling. You're the only one that's going to look at this piece of paper anyway. But improvement in mental functioning, that's an important piece to write down. So that's number 2. 3 months of TCC is Tai Chi Chuan, reduced cellular inflammation responses, and reduced expression of genes, including pro-inflammatory mediators. This is important. This is part of why Tai Chi helps possibly with cancer, is you're in an immune suppressed state, often with chemotherapy, and Tai Chi helps improve that immune system functioning. This is research that proves that Tai Chi does help with that immune system functioning. Given the link between inflammation and cancer incidence and progression, these findings provide an evidence-based molecular framework to understand the potential effects of mind-body therapies such as Tai Chi on cancer survivorship. So that's number 3 on your piece of paper, improvement in immune system function. Significant improvements were found in self-esteem in the Tai Chi group compared with the psychosocial group, support group. This is an important piece as well. Positive influence on the quality of life and psychological health. high retention rates compared with the retention rates below 85% in the other exercise promotion trials. Tai Chi may be a sustainable form of physical activity for the cancer population. So there's a couple things now that I want you to write down. Number 4, I want you to write down quality of life improvement, increased self-esteem, positive outlook. And you think about someone with cancer, how devastating that can be. And it's important to have something that provides a positive outlook for them and actually improves their psychological health, their self-esteem, their quality of life, the way they're looking at how the rest of their life is going to be. And number 5, I want you to write down, Tai Chi is doable for the long term, and that it's safe. This is also a key piece. And as we go through this, we're going to fill out our piece of paper, but you're going to also be coming back to each of these and starring them each time you see them in other studies, because Tai Chi is an amazing form of exercise that provides not just exercise, not just strengthening of muscles, not just strengthening of the cardiovascular system, which it does, but there are things about Tai Chi that you will see come up over and over and over again in these studies. So we're through number 5 now. Fibromyalgia, if you haven't heard of it, if you're not dealing with an older population, it is a disease that's characterized by chronic pain. Unfortunately, it's something that's, it's no definitive medical test. It's just something that, okay, you're in pain all the time and we've eliminated lots of other things, so we're just going to call it fibromyalgia, and it can be very debilitating to people. The most effective treatment is a combination of education, stress reduction, exercise, and medication. So let's look at the studies with fibromyalgia, the effect of Tai Chi versus aerobic exercise for fibro. And aerobic exercise has been the go-to exercise for fibro. And they looked at this and actually determined that the Tai Chi mind-body treatment results in similar or even greater improvement in fibromyalgia symptoms than aerobic exercise. Longer duration of Tai Chi showed greater improvement. This mind-body approach may be considered a therapeutic option in the multidisciplinary management of fibro. And that's a key word too, multidisciplinary. It's a piece of the puzzle. This study focused on fibro. Remember, people have stiffness, there's a lot of pain in their movement. This focused on functional mobility. And it determined that those in the Tai Chi condition compared with the education condition demonstrated clinically and statistically significant improvements in their fibromyalgia impact questionnaire, in their brief pain inventory. Functional mobility variables, including timed get up and go, static balance, dynamic balance, these are things that we do as fitness professionals, were significantly improved with Tai Chi compared with the education control, and no adverse events were noted. Remember that number 5, I said doable for the long term and safe. I want you to star safe because we just saw it again. No adverse events were noted. And then I want you to put on number 6, improvement in balance and functional mobility with less pain. Improvement in balance and functional mobility with less pain. This study was a meta-analysis of things about chronic pain, and if you notice that list, osteoarthritis, rheumatoid arthritis, fibromyalgia, we're going to talk about arthritis as well today, concluded that during Tai Chi exercises, the slow motion and weight shifting, remember that list of underlying basic principles, the slow motion and weight shifting may improve musculoskeletal strength and joint mobility. Concentration and mindfulness meditation may modulate multiple aspects of health, including mood, functions of the immune system, and autonomic nervous systems. So there you go again, in improving that function of the immune system, in improving mood. I want you to write down for number 7, fluid, flowing, gentle movements. Fluid, flowing, gentle movements. Here's a testimonial that I have I teach Tai Chi in my studio here in Denver, and one of my students has fibromyalgia. And she told me that, you know, it's some days it's even hard to take a walk. But she says that Tai Chi is something she can do even on days when she's not feeling great. She said she once read that the brain of a person with fibromyalgia is in constant fight or flight mode. And that makes total sense to her how she feels. Tai Chi has an amazing calming effect on my mind and body. The slow, fluid movement and measured breathing definitely promotes relaxation. This is something that someone with fibro, if they can find a movement that they can do that doesn't make their body hurt more, that's something that they want to continue to do. So number 8, I want you to write down calming, reducing stress, lowering blood pressure, and if you want to, in parentheses, put parasympathetic state. I did a whole webinar, again, it's on that YouTube channel. I did a whole webinar earlier in the year on stress and how Tai Chi actually helps the body get into the parasympathetic state, which is where we need to be living most of the time. It helps us get out of that fight or flight mode. So if you're interested in more of that research on stress relief, you can go to that webinar as well. But number 8, I want you to write calming, reducing stress, lowering blood pressure, and parasympathetic state. I have another testimony. I have another lady who's 72 who not only has fibro, but she has arthritis as well. She came to me a few years ago, and she says she saw improvements in her balance were most evident. You know, if you want to start starring improvement in balance, that's something, obviously this isn't a research study, but this is anecdotal evidence. She also states movements became smoother and more fluid, requiring less energy as she's continued to do Tai Chi. Now this lady had also a back surgery, and she's gone back to her Tai Chi after having that back surgery. It was a very important piece of her recovery. But I put her testimonial in between the fibro and the arthritis because she has both of them, and it has helped her with both conditions. We did an entire webinar on arthritis and Tai Chi as well, but I want to go through it because this is the leading disability in the United States. There are many, many, many people that are suffering from arthritis, and I find this interesting that it's not just a single disease, that it's a group, it's just an umbrella term, much like cancer is an umbrella term. Common arthritis joint symptoms include swelling, pain, stiffness, and decreased range of motion. Again, we've got, along with fibro, people are in pain, and yet movement is going to help them get out of pain, but that's a conundrum. Tai Chi can be that perfect exercise to solve that conundrum. This one is about rheumatoid arthritis. Patients experienced improved physical condition, confidence in moving, balance, and less pain. Again, you can star that: improvement in balance, less pain. Tai Chi is a feasible exercise modality in RA. This was a meta-analysis where it's talked about Tai Chi and significantly improving pain, stiffness, and physical function in those with osteoarthritis. So both rheumatoid and osteoarthritis. This was a study that I found very fascinating, that it compared water exercise with Tai Chi. Now, we all think of water exercises for people with arthritis because it does take that pressure off of the joints. And One of the things that I found fascinating is that it resulted in improvements both with Tai Chi and with the hydrotherapy. For me, that's an important piece because Tai Chi is an alternative form of exercise that can provide those same benefits to people. I personally do not like to be in the water. And I'm sure that there are other people who would prefer not to put on a swimsuit, not to have to find a pool, but be able to go to a Tai Chi class. So on your sheet of paper, we can finally fill out number 9. I want you to put alternative form of exercise. It's a piece of the puzzle. So you now have all 9 of those things on your sheet of paper. I'm just going to real briefly go through those. To light, gentle exercise, encouraging participation, improvement in mental functioning and psychosocial health, improvement in the immune system functioning, quality of life improvement, self-esteem, a positive outlook. It's doable for the long term. It's safe. You have an improvement in balance and functional mobility with less pain. Fluid, flowing, gentle movements, that's actually an important piece. Calming, reducing stress, lowering blood pressure, entering that parasympathetic state, and it's an alternative form of exercise. So now as we go through the rest of these studies, which we have more to do, I want you to be starring these 9 points as they come up. Tai Chi is a lower intensity exercise with flowing circular movements, balance, weight shifting. You see lots of these 9 things in this. Deep breathing, meditation, focusing on internal awareness. Tai Chi encourages patients to move fluidly with less strain and improved joint mobility. The nature of Tai Chi and the multiple potential effects on the body and the mind that differ from other conventional exercise may account for these beneficial effects. This was a meta-analysis again on Tai Chi and osteoarthritis. Another condition that is characterized by slowing of voluntary movements. We've got gait issues in Parkinson's, muscular weakness. Parkinson's is again something that there's no test. They just kind of have to eliminate, but it is something that people have to deal with as a chronic progressive disease. Movement helps, but there's this conundrum of how do I move when my joints are stiff, when it's hard for me to walk. Lots of studies have looked at this, looked at Tai Chi in terms of Parkinson's as well. Non-motor symptoms such as progressive cognitive decline also contribute to the worsening of physical function. This study goes on and says Tai Chi training significantly improved not only balance function, you can star that one, but also visual attention in older adults at risk of progressive cognitive decline. They hypothesized that apart from being a form of physical activity, Tai Chi demands memory training for the complex motor sequences as well as coordinated pathway between attention, voluntary motor action, postural control, verbal and visual imagery. I know that's a lot, and I know I'm reading this, but it's important for you to understand that these studies are coming through with the movements, the actual understanding those underlying principles and coordinating those movements with that relaxation is helping people with Parkinson's. It lowers feelings of stress and increased vigor in the patient's population. The Tai Chi group experienced significant improvement in the emotional well-being. That's an important part. We're going to see that come up again in a testimonial that I have. Tai Chi with Parkinson's substantially improved the balance. This is something that Parkinson's deals with. They're at an increased risk of falling. And the Tai Chi group performed better than the stretching group, than the resistance training group with this lowering the incidence of falls. Look at that last sentence too. No serious adverse events were observed. The effects of Tai Chi training were maintained at 3 months after the intervention. You want to mark on there, it's doable for the long term. It's safe for these populations. This is something that helps them feel encouraged that they can move. Tai Chi plus medication resulted in significantly greater benefit in terms of general motor symptoms, balance, mobility, and stride length. The movements of Tai Chi include weight shift, body rotation, slow strides, and single leg standing in different positions. Remember those underlying principles, requiring delicate joint control with muscle coordination. Tai Chi possibly trains postural stability and balance. You can star on that balance improvement again. This was one of my students, John. He wrote this. Said, along with the physical part of my existence, the psyche is a part of the equation that a lot of Parkinsonians overlook. It helps me get a grip on my jumbled up world. Tai Chi is very calming. The movement in Tai Chi helps my balance, getting control of my body and my gait. Tai Chi gives me the structure that I need to physically function every day. You know, I don't have Parkinson's, but this, to me, hearing it from someone and not just the studies, that's an encouragement to me that it is something that they enjoy and they feel the benefit. This comes from one of my instructors in Alabama. She has a student, Linda, who is a Parkinson's patient. She's been doing Tai Chi since February, and before she had Parkinson's, she was a ballroom dance instructor, so she understands her body. And she says, since I began practicing Tai Chi, I've noticed an improvement in my ability to focus, that mental improvement, as well as improvement in my balance, and that's important. This is another piece, another testimonial from Peggy in Alabama. Another one of her students, Roger, he says, Tai Chi has helped me significantly improve my balance beyond my regular rock steady class. It adds an extra component to my workout. I recommend it to everyone, and particularly for those with Parkinson's. So you can start here, you can start this alternative form of exercise. He has his rock steady class, which is important. That's a good piece of the puzzle. But Tai Chi adds another component to it. We have to start looking at Tai Chi as a piece of the puzzle. No, it's not the entire puzzle. We all know that we need to do strength training. We need to do aerobic, cardiovascular training. But Tai Chi is a piece of that puzzle that can help people with chronic illnesses. You can expand your vision of what Tai Chi can do. And that's what that's what I'm trying to show you today. MS, often lumped with Parkinson's. It's a nervous system disease that affects the brain and the spinal cord. Often movement is very difficult, especially in the morning time. There's a lot of symptoms with multiple sclerosis that Tai Chi can also help with. Better balance, better gait, less fatigue and depression, and we'll kind of come back to that fatigue one in just a second, but better quality of life. Again, if you're starring things on your sheet of paper, your paper should be full of stars by now with everything that Tai Chi can do for all of these different populations. It's safe and provide physical and psychosocial benefits in individuals with multiple sclerosis. This study here was specifically on quality of life and functional balance in MS, with patients with MS. The Tai Chi group demonstrated significant improvements in quality of life, such as pain, emotional well-being, energy, social function, health distress, mental health composite. This study, I thought it was important to show you. This was a study of 5 different studies, where it talks about fatigue in MS. And that's one of the things that is really commonly reported. In some of the studies, it showed that Tai Chi had an impact on the fatigue. On some of the other studies, it did not show it. It has been shown to provide relief in cancer patients, in those with arthritis, but it's not as conclusive with MS. That doesn't mean it's not useful for MS. You just have to realize it's not the be-all and end-all. It's a piece of the puzzle. Patients suffering from multiple sclerosis experience a wide array of symptoms, including balance problems, mobility impairment. We just talked about fatigue and depression. And Tai Chi, it says here, the Tai Chi group showed significant, consistent improvements in balance, coordination, and depression. We're almost through with this research section, so I'm glad you're staying with me. I know this is tough to slog through, but it's important to know that it's not just, I like it, so I want you to give it to everybody. I want it to be available to the everyday person. I want it to be available to those with chronic conditions that are possibly in rehab situations, which we're going to talk about next. I want you to understand that the research proves this out. So obviously cardiac events, stroke, they're not the same, but there's research that if you include Tai Chi with this in their rehab, it's actually a very important piece of the puzzle. Recent studies found exercise with lower intensity, so remember that very first one, light exercise, had benefits to those with coronary heart disease. The exercise intensity of Tai Chi is low to moderate, depending on the training style. Research substantiates that Tai Chi enhances aerobic capacity, muscular strength, endothelial function, and psychological well-being. In addition, Tai Chi reduces some cardiovascular risk factors, such as hypertension, remember that, lowering blood pressure, and dyslipidemia. Tai Chi may be prescribed as an alternative exercise program for selected patients with cardiovascular disease. It's doable for the long term. It has an effect on stress, lowering that amount of stress, and I have a testimonial for you on that as well. This was a nurse practitioner study, said it's a safe alternative for exercise for those in cardiac rehab. Cardiac rehab exercise training traditionally includes some form of aerobic exercise, some muscle strengthening, but in this study, it suggests the potential benefits from Tai Chi performed as an adjunct to cardio rehab. That's the piece of the puzzle. That's that alternative exercise. And the study that, if I can go back here, this is not a study. This is actually an article from Harvard Medical School. I found this fascinating, that those in cardiac rehab, they've just had an event, a heart event. 60% of those people choose not to attend rehab. Some of it is for travel cost, but sometimes it's because they think it's too difficult or too tiring. And this is where Tai Chi steps in. Tai Chi is not as physically demanding. It encourages people who are reluctant to exercise to move more. It emphasizes breathing, focused attention, and visualization. All of these factors seem to help lower stress, something doctors increasingly realize play a role in preventing heart disease. So again, that alternative form of exercise, lowering stress, fluid motions. This testimonial is from one of my students, Marty. This is a woman. At age 58, my body was assaulted by what people refer to as the widowmaker. It means she was 100% occluded in that left anterior descending artery. She talks about being prompted at rehab to meditate, which she said she failed miserably. So she tried Tai Chi as a movement meditation. And that's where she found the ability to really pull up that calming, that peaceful sense, learning how to breathe. She said, I would often find myself in a meditative state and I could truly feel the stress vacate my body. It's been 2 years now since her heart attack. And she says, I believe that Tai Chi definitely has played a huge part in my rehabilitation, and I'll continue with Tai Chi. Move on to stroke rehab. It as well talks about stroke survivors receiving Tai Chi as rehabilitation, recovering better compared to those that are only receiving conventional rehabilitation. And a lot of that has to do with those 9 points that we have listed on our sheet of paper. An effect on the immune system, a positive effect on the immune system, is important in a stroke patient. This study I found fascinating, where they had an hour of group practice, and with stroke rehab, it's often an individual rehab situation, whereas Tai Chi can be a group practice, and that's an important addition to their rehab. They had a group, 1 hour of group practice supplemented by 3 hours of self-practice. And they were, the outcome measures were dynamic standing balance, center of gravity, making sure that standing equilibrium was evaluated, and functional mobility. The Tai Chi group showed greater center of gravity excursion amplitude and leaning forward, backward, and toward the affected and the non-affected side. This is great for stroke rehab. And the one that I wanted to, which of these things is not like the others, which group? I want you to think of Tai Chi for athletes as well. No, it's not a chronic condition. No, it's not an illness. You don't think of athletes as being compromised, and yet Tai Chi, if you look at those 9 things on your sheet of paper, Tai Chi is something that absolutely can help an athlete. This is from, okay, we've moved out of the research realm, just to be clear. These are just articles. This is off WebMD. Elite athletes can also benefit from doing the slow movements because everyone needs better balance and muscle control. Duh. What athlete can't improve their game by being more balanced, by having better control? This was just an opinion. This was just a blog from somebody, but I found it interesting. He's a serious athlete. He saw people doing Tai Chi and he said, what are they going to gain? That's so slow and it looks useless. He figured out that it's not a lesser form of exercise that old people do just because they can't do anything else. It really is for other populations, including athletes. He said it increased his body awareness, and it's helped him not only in his athletic ability, but in his life. His statement is that Tai Chi and Qigong can help athletic performance by increasing body awareness, by improving flexibility and strength, and by decreasing the chance of injury and allowing you to bounce back quicker from the injury. I know in myself that Tai Chi has allowed me to continue to do the things that I love to do, some of the harder forms of exercise. By having that softer form of exercise in addition to, I know that I can continue doing my punching and kicking that I like to do. This was something, this is just an opinion, but he brought up Tiger Woods practices Qigong, and Novak Djokovic practices Tai Chi every morning. So top golfers, top tennis players, and he talks about why. Again, he talks about body awareness, finding that extra gear, removing tension. It comes back to understanding where that stress is and being able to remove that stress from your body. Because if you're all tense, you can't be at the top of your game, right? That's not possible as an athlete. So at this point, I actually want to leave that research realm, and I appreciate that you have written down your 9 things on your sheet of paper. Don't disregard that sheet of paper yet. But I want to show you a YouTube video that we did recently for Tai Chi as a cool down. Being able to use Tai Chi in a way that you might not think after doing some exercise. So I'm just going to play this part of it. If you want to stand up and follow along with me, that would be great. You can feel the relaxation coming from the movement. We're going to start our cool down with a move called Repulse the Monkey. You're going to bring your left arm forward, your right arm back, and you're simply going to rotate. Remember, I talked about rotation as being an important one of the principles. And gently bringing that arm forward and back. One more of those on each side. And now we're going to do some kicks. So remember that column and your substantial and insubstantial. You need to bring your weight over and lift and kick. Then you're going to bring your weight all the way over onto the other column and lift and kick. That makes this side substantial and this side insubstantial, so it's easy to lift and kick. Now we're going to add a smash and box the ears to those kicks. So kick for me, then smash. Then as you lower that center of gravity, move from your dantian, you can relax into that box the ears position. So let's try it on the other side. You're going to kick, smash, lower that center of gravity and relax into that box the ears because you're moving from your dantian. We'll do it again. Kick, smash, and box the ears. This time I'm going to add a pushing chi. Just rock back, bring your hands to the level of that dantian, and then let them float up and back, open forward. So let's do that kick, smash, and box the ears. And then you're going to add that pushing chi. So bring it back, and then let those arms float up and forward. Kick, smash, and box the ears with pushing chi. Kick, smash, box the ears. Now add the breathing. Take a nice deep breath in as you come towards your body, and then breathing out as you push away. One more of that combination. Kick, smash, and box the ears. Breathing in on that pushing chi, and then breathing out. I want you to stay with pushing chi, taking a nice deep breath in, and breathing out. Remember, as you're breathing, it's 360 breathing, filling that cavity about to 80%, so there's no tension, making it long and slow and continuous. And let's do pushing chi on the other side. You're breathing in as you come towards your body, and breathing out as you push away. One more pushing chi. And now we're going to do pushing the mountains. So we're concentrating on the breathing, breathing in, and then breathing out, opening up those joints. Breathing in as you gather, and then breathing out and kind of sink into your knees. Breathing in, breathing out, relax. Breathing in, and breathing out. And we're going to finish with heaven and earth. So as you breathe in, you're going to extend fully up. Follow your fingertips with your eyeballs. Look to one side as you open up. Then I want you to hinge from your hips, turning your palms forward, coming back up, fully extend, and then let it relax down. We'll do that one more time, taking a nice deep breath in, breathing out as you open up and hinge. Breathing in and breathing out. Okay, so I hope you enjoyed seeing that. You can practice that. It's on our YouTube channel. It's also on our website, taichisystem.com, Cooldown. We not only have it on the video section, we also have a PDF that explains each of those movements, that explains how to do each of those movements. So take those movements, use them with your clients next week. Use it as a cool down after a class, maybe after a workout session. If you take your sheet of paper and you look at those 9 things again, Tai Chi, if you write across the top of your piece of paper now, why Tai Chi is successful. You've got 9 things that the research proved over and over again for different populations of people, the everyday person. You think of it as a light, gentle exercise, that it encourages participation, improvement in mental functioning and psychosocial health, improvement in immune system functioning, improvement in quality of life, increasing self-esteem and a positive outlook. It's doable for the long term and it's safe. There's improvement in balance and functional mobility with less pain. It has fluid, flowing, gentle movements. It's calming, reduces stress, reduces blood pressure, helps you get into that parasympathetic state. And it's an alternative form of exercise for people to include in their program. If you look at all those different pieces, it looks surprisingly like a combination of those first 3 slides that we were looking at. The definition, Tai Chi is a martial art that utilizes gentle, flowing movements to enhance health in the body and the mind. It provides benefits such as improving balance, reducing falls, reducing anxiety, increasing energy and agility. And those benefits happen because of those underlying principles, applying columns, knowing where your weight is, moving from the dantian, because of the circular movements and the breathing, all bringing the benefits of Tai Chi. If you're dedicated at all to bringing health to the everyday person, Tai Chi is a crucial piece of the puzzle. I will never tell you it's the only piece. I'm not saying you only need to do Tai Chi in order to be healthy, but it is a crucial piece of the puzzle. And that's why I created the Open the Door to Tai Chi system, is so that you can learn it, so that you feel comfortable learning it and you feel comfortable bringing it to your community, because those are benefits that the everyday person needs and wants. They're looking for it. The system is easy. It's all online. I teach you the history of Tai Chi, I teach you the individual movements, and then I teach you the flow of the form. In that final section, I teach you those underlying principles that we talked about, because those are the important piece. You can't just do the movements. You have to understand those underlying principles. Then I also help you organize your classes. I give you class plans so that you don't have to struggle figuring out how to start if you want to start teaching Tai Chi. We also have a very vibrant group on Facebook that's a membership group, so that you're not out there teaching Tai Chi all by yourself. And that's an important piece, because that after certification support helps you as you're teaching. It helps you continue to learn and provide those benefits. The certification, if you're a fitness professional, it does provide CECs, which that's a piece that we all have to gather, so know that it does provide that. If you're looking for some learning of Tai Chi that maybe not interested in certification yet, that's okay. We have smaller videos, basics of balance, basics of stress relief, and wake up with Tai Chi. These are great places to start. And you learn a simpler form, but you also do learn those underlying principles, because like I said, you can't just learn movements. You have to learn those underlying principles and learn how to apply them. Remember that I mentioned that we had done an entire series, an entire webinar on cancer. We have a partner page on our taichisystem.com. You can get to Andrea Leonard's course from that taichisystem.com if you're interested in that. It's a great course. If you're interested in learning some more Tai Chi other than just that Cooldown that we just talked about, or you're not quite ready to dive into either the certification or the daily series, there is a free mini course also on that taichisystem.com. Look at that website. There's lots of information. But if you have questions, or if this webinar has just really brought up thoughts in your head, send me an email, Diane@taichisystem.com, and I will gladly do a phone consultation with you so you can talk through some of these issues. I want to be able to help you overcome whatever questions you might have. So we do have some questions. I know that Lynn wrote in ahead of time. She wrote in, she said she had, knows someone with Ehlers-Danlos syndrome, which is a connective tissue disorder. And she wanted to know, can you modify the movements of Tai Chi? And she was specifically worried about the semi-squatting positions. And yes, Lynn, you absolutely. And that's part of the Open the Door to Tai Chi system, is that I want you to modify as needed. This is not done for perfection. This is done to help your body be the best it can be, whether you're an athlete or whether you're dealing with cancer or coming back from a heart attack. Another question today is, says that, can Tai Chi help a person whose nerve pain keeps them from standing for more than a few minutes? Yes, Len, this is, there are seated modifications, and that's part of the Facebook group that we have with our instructors, is that we have those seated modifications so that you can help your clients that can't stand. We want people to stand if they can, but if there's something that's preventing them from standing, then yes, there are seated modifications as well. Just like I told Lynn, we can modify as needed. And yes, Sharon, I will give you a copy of the slides, don't worry. James, what were the 4 items mentioned in number 6? Education, stress reduction. No, let's see. I'll go through the list again. If you have it's a calmingness or reducing stress, lowering blood pressure, entering that parasympathetic state. If that's not where you were asking, I'm not quite sure what that question is, but if you want to write in again and kind of clarify to me, that's good. I have time for a couple more questions. Rick says, I've heard that boxing is good for Parkinson's. Can somebody do both? Well, of course. Like I said, it's a piece of the puzzle. And yes, I have seen a lot of really fun boxing classes for Parkinson's patients, and they're enjoying themselves. Again, that can be that piece of the puzzle where they have a harder form of exercise and then complement it with Tai Chi as a softer form of exercise. Let's see. I have one more question here. Does it help avoid flare-ups with fibromyalgia? That's an interesting question. Kathy, this is something that my fibro people, they talk about it's really difficult with, they don't know when their body's going to flare up, when it's going to rebound from doing exercises. Because Tai Chi is so gentle, and we do encourage modifications and approaching it at your own ability, that most people with fibro, at least in my experience, have found that it doesn't cause that rebound effect. It doesn't cause the flare-up. But again, fibro can be very unpredictable. So you have to modify, you have to take it as your own body, what your own body will be able to do. Let's see. I think that's about it. We already answered, I had one more question about seated Tai Chi. I already answered that. I really appreciate everybody coming in today. Again, look at our YouTube channel. It's Open the Door to Tai Chi. We have all of our webinars there. We also have more information on our website, taichisystem.com. That cooldown video that you saw is on the website, taichisystem.com/cooldown, or it's on the YouTube channel as well. Thank you so much. I am going to do a commercial for our next webinar. Coming up in September, I'm going to have a panel of people who have taken the Open the Door to Tai Chi certification and who are currently successfully implementing Tai Chi in their communities in different ways. Some of them own their own studios, some of them teach out of a YMCA. I wanted you to hear from them how it's helping their community and any struggles that they may have had in implementing Tai Chi. So look forward to that. That's coming up in September. Again, I hope you have a great day. We'll talk to you guys later.